All right, so our last and final unit is going to be psychological disorders and then therapy. So what we're going to seek to understand in this unit is what does it mean to have a mental disorder, how we define and classify disorders, what anxiety disorders are, including things like OCD and PTSD, mood disorders, including depression and bipolar disorder, schizophrenia, and a sample of other disorders, dissociative disorders, eating disorders, and personality disorders. And we're also going to talk about rates, vulnerability, and other protective factors. So, why do we learn about psychological disorders? Well, there's curiosity. One, personal familiarity with psychological symptoms, knowing somebody with a disorder, hearing about how prevalent and socially devastating the disorders have become in our society, and wanting to learn more about mental health and human nature. So, there's a lot of reasons, everybody has their own personal reason for wanting to know and understand what, how and why and what and when and where and all those things about these different disorders. Now, there's some perspectives in psychological disorders that we need to understand. One of the first things is how we define psychological disorders. Thinking critically about a disorder such as ADHD, understanding psychological disorders, classifying psychological disorders, labeling psychological disorders. Okay, and then insanity and responsibility. It's kind of what we're going to talk about right now. So, some questions to keep in mind. How do we decide when a set of symptoms are severe enough to be called a disorder that needs treatment? How can we define specific disorders clearly enough so that we know that they're all referring to the same behavior or mental state? And how can we use our diagnostic labels to guide treatment rather than stigmatize people? And see, these are some big questions that, psychologists have been working with and studying with for a long time. Because, what you're going to notice, and I want to caution everybody with this, is that lots of you are going to relate to a lot of the stuff that we talk about. But that doesn't necessarily mean that you have the disorder, right? Because there's symptoms, and there has to be a severity, there has to be a duration, there has to be, certain things like that before we actually consider it a disorder. So, what are psychological disorders? They're patterns of thoughts, feelings, or actions that are deviant, distressful, and dysfunctional. Okay, so one of the things to remember are the 3 Ds of psychological disorders: deviant, distressful, and dysfunctional. So, some of these terms. First things first, a disorder refers to a state of mental or behavioral ill health. Okay. Patterns refers to finding a collection of symptoms that tend to go together, not just seeing a single symptom. Okay, and for there to be distress and dysfunction, symptoms must be sufficiently severe to interfere with one's daily life and well-being. Okay, so these are some really important things to remember. Patterns, it's not just one symptom, it's a collection of different symptoms, okay? And then also there has to be distress and dysfunction, which means that it has to interfere with your daily life and well-being, okay? Not just one day, okay? It has to be a continuous, this pattern of days. Now, deviant, okay, which is an interesting term because we use it in a much more stigmatized way today, means differing from the norm, okay? When we use it in psychology, we're talking about that it differs from the norm, okay? So what is deviant, okay? To deviate from something in general means to vary from what would typically happen. In psychology, we're talking about a deviant by a culture when it would be different from what would be expected in that culture. Now, the culture thing is really important to remember because what is normal in our culture might not be normal in another culture. Therefore, what is deviant in our culture might not be deviant in another culture. Okay, so we always have to take cultural relevancy into consideration. Now, a disorder may also be a deviation from a typical developmental pathway. Okay, so we oftentimes talk about a deviant in terms of they're not developing in the normal kind of way. Now, defining deviance in the role of context and culture. Context is important. Whether a behavior varies from expectation depends on the situation in which it occurs. Yelling for hours is not deviant when it happens at a football game, but it is deviant if it occurs kind of in a context in which it's not appropriate. Now, culture, these painted faces might seem deviant when viewed from another culture. Okay, so culture, context, and deviance are important kind of relationship to understand. Now, ADHD, it's a lot of attention. Is this a disorder? Is it deviant? Do some people have a level of inattentiveness, impulsiveness, or restlessness that goes beyond laziness or maturity? Is it distressful? Is the person enjoying being energetic, or are they frustrated that they can't sustain focus? Is there dysfunction? Are the symptoms harmless, fun, or do they negatively impact work and relationships? And the answer to all of these questions is yes. Okay, it is a disorder. Now, the problem with ADHD that we see is that oftentimes it is misdiagnosed, overdiagnosed, especially in boys and in young children, and underdiagnosed in girls. And we'll talk more about more of this specifics in class. Now, understanding the nature of psychological disorders. One reason to diagnose a disorder is to make decisions about treating the problem. Okay, this is, why we want to diagnose you so that we can treat you. Now, to treat a disorder, it helps to understand the nature or the cause of the psychological symptoms. Based on older understanding of psychological disorders, treatments have included things like exorcising evil spirits, beatings, caging and restraint, and drilling holes into the head to release evil spirits. So Philip Pennell came up with a new approach to this. Okay, he sought to reform brutal treatment to promote a new understanding of mental disorders. And so he proposed that mental disorders were not caused by demonic possession, but by environmental stressors, such as environmental factors such as stress and inhumane conditions. So he kind of brought in moral treatment involved with improving the environment and replacing the asylum beatings with patient dances instead. So from the humane view to the scientific view of the mentally ill, Philip Pennell kind of did this transition. Okay, but then the discovery that the disease of syphilis causes mental symptoms by infecting the brain suggested a medical model for mental illness. Okay, and the medical model basically sees is that psychological disorders can be seen as a psychopathology, an illness of the mind. So disorders can then be diagnosed, labeled as a collection of symptoms that tend to go together, and that people with disorders can be treated, attended to, given therapy, all with the goal of restoring mental health. Okay, so Philip Pennell started the kind of the humanity of this, and then we kind of went into the medical model, and we started to realize that, we shouldn't treat mental illness any different than we should treat a physical illness. Okay, and this brings us into this biopsychosocial approach, where we want to consider all three of these factors whenever we are looking at a mental illness. Okay, now cultural influences on disorders are something too important. There are such things as culture-bound syndromes, which are disorders that are only seem to exist within certain cultures, and they demonstrate how culture can play a role in both causing and defining a disorder. So, for instance, bulimia nervosa, binging and purging, is typically only found in the United States. Running amok, which is a syndrome, these are violent outbursts in Malaysia, and I'm not even going to attempt to pronounce that one, but this is social withdrawal that's found in Japan. Now, next time we're going to pick up on how we classify psychological disorders.